Oh, it's so different. I see surgery every day. I work with my patients. I get them ready. I take care of them afterwards. And it's so different being on the other side. I've actually suffered with uterine fibroids for years and years. Constant pressure and pain 24/7.
She's had a variety of fibroids. I removed one. I did a myomectomy on her a few years ago.
I was taking a lot of pain medication. I was taking medications to help stop bleeding every month, and that just, it got to be a lot.
So when I was able to have this new procedure, she was one of the first people I thought of.
I was on board immediately.
So what's new is this radiofrequency procedure. And so essentially you're working laparoscopic, so tiny incisions in the abdomen, and you go in and you're using an ultrasound laparoscopically, and then you're using a laparoscopic needle, and then you can use the energy from the radiofrequency to heat up the fibroid, and essentially breaks down all the little proteins that make the fibroid a fibroid, and so it kind of shrivels and shrinks it up.
The thing is that they just come back. But with this new procedure, when you get this done, they do not come back in the same spot again.
The reason I'm loving this is because it allows women to, still have fertility in the future, and they're not subject to a C-section, which is amazing. Typically, we never had anything to offer those women before. And then the other thing about it is that you aren't removing anything, so the restrictions afterwards are essentially nothing, like a couple days post-operative type recovery, to be able to help them in a fashion that doesn't impact their life from a long recovery standpoint, I think is really huge. So I love being able to offer that minimally invasive option.
I feel so good. I don't have constant pain. I don't have constant pressure. This is the best I've felt in a while from, being diagnosed and having these fibroids for years. I hope that when you notice something wrong with your body, that you're having abnormal pain or pain that's more than usual, or abnormal bleeding or something that you just don't think is right, that you should get into your OB doctor, your GYN doctor, and get some stuff figured out, because there could be something wrong. I put mine off for a little while, and I wish I wouldn't have, because it's helped me so much.
That's probably one of the best parts about my job, is like the long-standing relationships with people, but also like when you've already tried all the things for people and you get something new and it works, it's so rewarding. It was such a big win for her and for me, and I think for Avera in general, that we're offering it now.